Thank you,
So,
madam,
what do
for
you
giving
bring
this
us today?
opportunity. As usual, I am the only male member in this entire crowd. So
No
I think
issues.
it's
Right now, we
nice
discussed
to listen
male and
to.
female are equal.
Yeah, yeah, nice to
Yes,
listen to
yes.
Chaya madam about that whatever story she has written.
Hmm.
To give a small background, maybe particularly to Chaya madam, I am from Coimbatore. I am a senior citizen. Of course, I started writing about some 7, 8 years back. The only thing which I wrote during my school days was imposition. I used to write imposition, I know, so many times. So that is where I started learning how to write. And now, of course, I write from my experience, whatever. So today I am going to speak or narrate my experience in an ICU. No, this is what intensive care unit in a hospital, ICU. Recently, my brother-in-law was hospitalized in a one good hospital here, and he was admitted inside the hospital, and then I was a ICU attender for him. So ICU attender means you will
Okay.
be waiting outside. They will give a bed also night time if you want to stay. And as and when they call, I have to go inside that ICU. So my brother-in-law was the problem is brain hemorrhage. So all the patients there are brain hemorrhage patients. They lost their memory and they keep talking all rubbish. So I was just collected those rubbish, whatever they spoke. So I just thought I will narrate those to you. And most of the people
Okay,
are
sure.
educated, and little bit of my imagination also was included in this. And one person says, I mean, the title was ICU Galatta. That is the title I have given. ICU Galatta. One fellow said,
Yes.
hell is better than coming to hospital. One fellow was shouting, hell is better than coming to hospital. The other fellow says, they are treating my body as if it is a dead body specimen. Because they are senseless, they don't have that consciousness, so they keep talking. Then another fellow says, they are taking my body instead of a scan center, they are taking my body to a studio. And then another person says, I am surrounded by morons, not by in the name of caregivers. And one person said the basic thing that motion will come only after a cup of coffee and a puff is not even that is known to not known to the caregivers. So he was shouting. So only after a puff and a coffee motion will come. That is also not known to these caregivers. And another
Okay.
fellow was shouting that putting injection in bone marrow instead of the vein. So he was shouting, and one fellow was an English professor. Inside one English professor, he said, empathy is not there in the dictionary of the caregivers. And when these people they came out, they uttered something. When they regained their consciousness, they uttered something different. So they said, "We are pained." I mean, their kid and kin they expressed, "We are pained when they are admitted inside the ICU, but we are relieved when they are out of danger." And we are pained at seeing the first bill they gave, but we are relieved when the condition is not critical. When they said the condition is not critical, and we are pained because they are still in ICU, but we relieved that when the patient started taking food, and we are pained at the physical hardship of the patient, but we are relieved when shifted to the room from the ICU when shifted to the room, and we are pained at the final bill because the bill amount is so big, but we are relieved by telling the stories to others by storytelling.
Wow.
Wow.
So
Wow.
these
Wow.
are some of my
This is,
observations
yeah.
there. I just wrote a piece of this one, so I thought I will share here, these things in this forum.
So
Thank you.
nice, sir. The topic was so unique, and the last line, so
Because we are all the storytelling,
yes, yes.
No,
Correct,
it's
correct.
Actually, it is really unique and creative topic you brought up. And second thing, mental illnesses and diseases like brain hemorrhage are really common, and we should be empathetic to the patients. And not only this disease, but when we talk about people who are suffering